So here I'm showing you how to raise papilla preservation flap using 15C blade. I avoid cutting through the papilla. When I use my knife, I cut down to bone at right angle to the tissue. This way the flap is full thickness, mucoperiosteal flap, which means it contains the mucosa as well as the periosteum. Here is the second limb of the flap. As you can see, I have spared the papilla. And then the third cut is slightly palatal to the ridge, so not mid-crystal, slightly palatal, again down to bone. And then you take your periosteal elevator to reflect the flap gently. So you start from the relieving incision. Always stick to the bone, take your time, raise a flap. It should be big enough to give you access and visibility. Now this is the first drill, the location drill to indicate the position of the implant. The implant I'm placing in this case is for the upper left tree, and then you just go sequentially from one size to another depending on the size of the implant. Then here I'm placing the implant manually, holding the implant with the carrier. Once the implant is stable enough, I remove the carrier and attach the handpiece with the driver. Torque in this case is adjusted to 50 when the torque is reached, as you can see, just below the crest. And then I attach the healing cap or healing abutment, ready to be taken out in 3 months' time for the final impression. And then the next step is to suture the flap. Here I'm using 340 Vicryl Rapide on a reverse cutting needle. Take your time suturing the flap. Do one bit at a time. Make sure you have good assistant. Here I have my usual assistant, the most amazing nurse, Khadija. So, interrupted suture, surgeon's knot. You cut it